Hi, everybody. We're here today with Doug Boysen, the President and CEO of Samaritan Health Services. Samaritan is the largest healthcare provider in Benton, Lynn, and Lincoln counties here. And Doug, thanks so much for joining us today. We appreciate your time.
Thank you for having me. I appreciate it.
Absolutely. Well, our first question is really, what is the status of affairs at Samaritan? You know, how have things changed since COVID-19 arrived?
Yeah, well, our world, as far as in healthcare, has changed drastically, but really every industry has changed, and this has impacted every individual in the world, literally. So it's been dramatic. In healthcare and for Samaritan, it's such a all-encompassing issue that it's hard to even describe. So it's easier for me to break it down, chunk it out in a few categories. And kind of the first phase of it all was really just trying to process what is going on and what is going to be our response to it, and just making sure that we have the right policies and protocols in place to make sure that we're safe for our employees and our patients. We relied heavily on our advice from our chief medical officer, and we're lucky to have 3 infectious disease doctors that work for Samaritan. So we followed their guidance. They followed guidance from Oregon Health Authority and from the CDC. And with that, we came up with our policies and procedures. And one of the first actions we took is that we did shut down our elective procedures and non-emergent visits. We actually did that about a week before the governors were to do that. We just felt like we had to jump on that very quickly. So there was the response, and then there was this preparation for a surge. That's the second component. That's something that was probably more of a sprint, has now become more of a marathon. But when I say surge, it's really getting ready for a situation where we see just a vast amount of patients that have COVID-19 that really stretch our capacity. Other situations or other areas have encountered that. New York, Seattle, Italy are examples of that. So we worked very quickly to make sure that we had good surge plans in place at all 5 of our hospitals, to make sure that we had enough bed capacity, that we had enough personal protective equipment, to make sure that we had enough equipment like ventilators, make sure that we even had enough staff to be there to treat patients if we had a surge. And then recovery is the third component. Just how do we get past this ultimately and make sure that we're ramping up again as a healthcare system, and make sure that we're taking care of the healthcare needs of people in their communities that don't have COVID-19, and how do we ramp that up again?
Well, and so I know people are really curious. Obviously, we all know that we're not experiencing as big of a problem as like New York City was.
Right.
But I don't think people really know what's happening inside the hospital, you know. And so I'm curious, are there COVID patients here at the hospital? Is there a special part of the hospital where they are? You say you have enough protective gear. Is that really accurate for what's happening there? And how is your staff dealing with people who have COVID, and how are they doing?
Yeah, thank you. So as I said, we've done a lot of work as a system getting prepared for a patient surge. We've never really experienced that at Samaritan. It never really materialized. It still could, but it hasn't to date. But we have seen a steady amount of patients with COVID-19 in our Good Samaritan Hospital here in Corvallis. That number oscillates between 2 and 6 patients that have COVID-19 at any given point in time here at Good Samaritan Hospital. At our Albany Hospital, that number oscillates between 0 and 2 inpatients with COVID-19. At our other 3 smaller hospitals, 1 in Lebanon, 1 in Lincoln City, and 1 in Newport, those 3 hospitals have actually not had a COVID positive patient in those hospitals yet. So it's around. We have not been overwhelmed with COVID-19 patients. It's certainly, there are many cases in our community, people that have tested positive that haven't needed inpatient services. I think in Benton County, we're up to about 50 positive cases. I think in Lynn County, we're up to about 100 positive cases. I think the reason that we haven't seen the patient surge here is because the social distancing, physical distancing efforts that people have done in our communities, wearing a mask, hand washing, all those things that each of us can do every day to help prevent the spread of the virus. I think all of that has worked, and I think Oregon was decisive and quickly started to adopt some of those measures, and that's made a difference to date. As far as our staff, you asked about our staff.
Yeah.
I couldn't be prouder how our staff has handled the situation. I think when there's a crisis like this, it can bring out the best in people, or it can bring out the worst in people. I think with Samaritan, what I've seen is it's really brought out the best in the people that work for our organization. They've come to work really courageously, coming to work knowing that they could be in a situation that could be a harm to them, to their health and welfare. But people keep coming in. They keep coming in to further our mission, and they're here to do the right thing for the patients in our communities, and I'm proud of that.
Oh, that was really, really great. The OSU Trace program is pretty innovative, and they're doing community testing here. And they reported, as I understand it, that approximately 2 out of every 1,000 people in Corvallis currently have the COVID-19 virus. I know that to other communities probably is small, but I don't know that people understand how to think about that. Should we think that is how should we think about that in terms of public risk, in your opinion?
Yeah, it's a good question. And I have been told anecdotally, I have not read the data around this, but the test results in Corvallis are similar to other like tests in other communities. So I think it's fairly similar. I will say, though Marion County has had a disproportionate amount of COVID patients, positive patients up there, just to the north of us. Now why that is, why are we less than them? I don't know. That's hard to explain. But I think what I take from those study results is that it's probably not widespread, but the virus is still in our community. And I think what we have seen is that in those places where there are congregate living spaces like skilled nursing facilities, or with employers who have a lot of employees working closely together, that as long as the virus is still out there, and if the virus gets to a place like that, that it can spread extremely quickly. And I think that's going to be one of the keys going forward, is that we are, when we see these clusters, that we are able to test very rapidly, determine who has it, who doesn't have it, and that we can do then what we call contact tracing. So when we identify a cluster and we start to identify those individuals that have the virus, then how do we do the tracing of them to make sure we understand who they've been around, and do we need to test those people then, and start to isolate who has the virus and who doesn't as quickly as possible, and then those people that do have the virus, to quarantine them as quickly as we can, so it doesn't spread anymore.
Very good. I know, in part because I'm one of them, people who've delayed appointments or procedures until kind of the dust settles. And how do you think people in the community should think about using or kind of consuming healthcare right now? Only when it's really urgent, or kind of the way they did before? And are there precautions that people should take when seeing their doctor?
Yeah, we stopped elective procedures and non-emergent visits back in mid-March, and I think the governor gave an order to stop that in March 23rd, I think. And then the governor has since given a new order that healthcare systems, healthcare organizations, clinics could start ramping up their visits and their patients again as of May 1st. So we've followed that order. We have started to ramp up our services again. Now I'll say it's a very slow ramp up. For hospitals, the governor's order is that you can't go above 50% of your normal historical capacity, and you have to do it in a way that you're preserving your PPE and that you have additional bed capacity if there is a patient surge. So we have taken all that extremely seriously. We're only going to ramp up if we can do it in a way that's safe for our employees and safe for our patients. But we're doing that. So we have started to do some elective procedures again within our hospitals. We have started to open up our clinics again. All of our clinics are actually opened up again, and we're not seeing anywhere near 100% capacity, but we are starting to treat people again more like we used to pre-COVID-19. On the patient side, what we've heard is patients didn't have COVID-19, but they had healthcare issues, and they've gone 6-7 weeks now without having maybe treatment that they needed. And so something that maybe was more of elective or non-emergent 6 weeks ago now is becoming more emergent. So we're trying to be there and be ready for those patients. I think for individuals, is it time for you to go in and see your doctor again is really probably a personal choice based on what individual symptoms or a disease that you have, and you need to assess that. But I can assure the folks out there that we're doing everything we can to make sure that when patients do come in, it's a safe environment. We're taking lots of precautions to make sure that we're not spreading COVID-19. And as I said before, we've never really had a patient surge to begin with in any of our facilities. So it is a little bit different than Seattle or New York City. But when you do come, you can expect that, we're going to ask for physical distancing, and we're going to ask that you wear a mask, and you're going to see all of our employees wearing masks as well. So it's going to be a little bit different, but we're here, we're ready, and we can treat patients again.
Wonderful. And if anyone has symptoms that resemble those of COVID-19, what is your message to them? What is their course of action, especially anyone who's concerned about making payments for seeing a doctor? What do they need to know?
Sure, that's an excellent question. And I do recommend if anyone has any symptoms that they seek advice on that, because we are trying to catch as many people that have the virus as possible. And we have, as an organization and as a county, really ramped up our ability to do tests now. So if someone is having symptoms, they can call their provider, and get a visit and discuss the symptoms that they're having. Samaritan is we have what we call e-visits. So, and there's information about that on our samhealth.org website. We have a whole page dedicated to the coronavirus and the latest information around that. But you can get on and do an e-visit, which is basically a algorithm that you can go through that'll help to fine tune whether what symptoms you have and whether that could be COVID-19. And then we do have providers that are then evaluating the results of that. And those e-visits are free. That's something that we've been doing just so people can take advantage of that technology, and we can start to get a better sense of how many people are carrying the virus in the community. And also, we're a nonprofit organization. We treat everyone regardless of ability to pay. So we're gonna treat people. And then the last thing I'll mention on this topic, part of the CARES Act relief money that was recently passed by the federal government is it does provide reimbursement for healthcare organizations that do COVID-19 testing for patients that can't afford to pay. So there's really a lot of options out there right now for people that they can't pay, and I hope that they can find information on our website that can help them navigate that.
Thank you. That was an excellent answer. Everyone's pontificating, about how healthcare is going to change.
Yeah.
And I'm not talking about doctors wearing masks and that kind of a thing. I'm talking about, will my doctor still be there for me to see in 3 months? Will the place that I'm used to going to exist? Who's going to merge? What's going to change? There's all this financial stuff that happens in healthcare that is confusing anyway to people.
Yeah.
So people, I don't think, know what to expect. Do you have any sense of what the healthcare landscape is going to look like around here in, 6 months or a year?
I have a sense. I don't think there's any human on the planet that knows exactly what it's going to look like. I'll talk first just about financially. I think from a financial perspective, it has been devastating on all healthcare providers. When we shut down elective procedures and non-emergent visits, which that was the right thing to do. So I was very supportive of that action. But that said, it decreased our revenue by about 50%. So it was like Samaritan took a 50% pay cut. And we had that pay cut for six weeks, and we're still not anywhere close to full capacity. So we're still losing money, and I think almost all healthcare organizations are losing money right now. I think, whether healthcare organizations have to merge or they go bankrupt and those types of things, I think that will largely depend on how quickly we can ramp up services again, and I think that will also depend on how much help we get from the federal and state governments. And we have gotten some assistance through the CARES Act passed by the federal government, which has been really helpful. It hasn't filled like the entire deficit or the gap for us, but it just depends, I think, how long this goes on. We have goals around sustainability, and we try and make sure that as an organization we can withstand something like this, and we certainly can withstand it for a short period in time. But if it goes on for 6 months, that's going to be difficult, I think, for any organization to withstand. So a little bit of unknown there. I will say just how healthcare is different on the backside of this. One positive thing that has happened, and I think there are some positives that had happened, but one is telemedicine. We have had a dramatic ramp up in telemedicine, and that has been because of a couple of reasons. One, because of patient demand. Patients still had healthcare issues, but they didn't want to come in, so we had to reach them in a different way. Two, there was some relaxing of federal regulation around telemedicine visits, which was helpful. So we saw, just in a very short time frame, we were doing more telemedicine visits than we had ever done before, reaching patients that maybe we hadn't reached before because we were doing telemedicine visits. I think that has been a real positive, and I think that's something that will stick. Now, assuming that the federal government doesn't go back and heavily regulate it again, and they probably will fine-tune it. I think that's a good thing. But assuming we can do that in healthcare, I think patients are going to want that, and I think it's a good thing. I think it's a good alternative for patients in the future.
Yeah, I think it's been a great change also. Something we all thought was going to happen and kind of got accelerated to everyone's benefit. Right. Our last question, Doug, is what gives you hope? What gives you hope in this situation? It can feel a little gloomy and grim sometimes. Yeah, what gives you hope?
Yeah, well, I'll just say there have been moments, I'll tell you. I made the comment early on that it started off as a sprint, and it was extremely stressful, and that's for everyone in our community. That's not just me, or that's not just healthcare. This has been a stressful time for a lot of people for all kinds of various reasons. And but there have been some good things. I'll say from a Samaritan perspective, just seeing how our communities have rallied around Samaritan and our healthcare organizations in our community, I think has been fantastic. We early on, we thought we were going to have a shortage of PPE, so mainly masks. We were nervous about that, especially seeing what was going on in New York City and Seattle. We had an outpouring of donations from people within the community that helped us with our PPE supply. We had an outpouring of people sewing masks and delivering those masks to our facilities. We had all kinds of local restaurants that were donating food for our staff. We had people giving us monetary contributions as a nonprofit organization to help us get through this. We had jet flyovers. Just really a lot of amazing things have happened that have highlighted the good work that our frontline staff and clinicians are doing within the organization every day. And then I think another really positive has been how not just healthcare, but local companies like yours, Sevs, and local county officials and city officials and state officials. I think just how well we've all been working together to get through this. I think that collaboration has been powerful in Oregon. And I will say, when you compare Oregon to other states, we're doing really well on the amount of people that have been infected with the virus. And I think it's because we were early in some of our measures that we took, but I think it's also because we've just worked on this in such a collaborative way. That's been really powerful. And so I think those good things that have come out of this, this collaborative spirit, if we can keep that rolling going forward, I think that's only going to make our community stronger.
Yeah, I agree. It has been really inspirational to see how our community has responded. Doug, again, I really appreciate the time that you've taken to talk with us. I know people are really curious about what is happening over at Samaritan, and to get this kind of detail is a real treat. So thank you very much again. Everyone, this has been Doug Boysen, the President and CEO of Samaritan Health Services, serving Benton, Lynn, and Lincoln counties here in Oregon. I'm Severin Williams at the Benton County COVID Connection. And thank you, Doug. We'll hope to talk to you again soon.
Hey, thank you so much for doing this. I think what you're doing is really powerful. It allows people in the community to get the information, the true information that we're actually seeing on a day-to-day basis out throughout our communities. So providing that vehicle is fantastic. Thank you for doing that.